Hi, welcome to Lightbulb Moment with Nurse Precious Medical Edition. It's nice to have you back here on the medical edition of Lightbulb Moment with Precious. Last time we discussed patients' rights, and today we're going to be discussing patients' responsibility because to who a right is given, responsibility is expected. Let's go right in. Number one, communication. As a patient, you need to know you have to communicate. You must provide complete and accurate information about your health history, your medication, and symptoms. You cannot hide anything from your doctors, or you cannot hide anything from the hospital because your life may depend on it. I've had patients who had died, had bodily harm, and got misdiagnosed because they withheld some information. You do not want that to be you. So be forward with information. In fact, even if you're not asked, provide some information. I've been in some consulting sessions that I would say things like, if after they say, but doctor, does this one connect to this? Yes, please make all these things available. It will help with the care. For instance, you are allergic to medication, you need to say so before we get an anaphylactic shock or allergy because we gave a particular medication. Please don't withhold information. That's number one responsibility. And the responsibility is compliance. My dears, you need to comply with medication regimen, whatever thing that your doctors and nurses, healthcare providers have told you to do. We cannot be trying to save you and you're doing the opposite of what we said. Please, dear patients, please. Oh, that's on a lighter note. So you cannot be hypertensive. I will give you a hypertensive drug. And you go home and they say you should not drink it, you should be drinking cover water. Now you're having hypertensive crisis. What miracle do you want us to do? I've lost one patient down. Very, very funny story. This patient, he was in the hospital with us and he was battling a kidney issue. Hey my God. In the hospital there, once we give him our own medication and we go, his relative will bring abo and give him. And we are wondering, why is this thing not working? We didn't know there was a counteractive effect of something going on behind the scene. This is dangerous for you. So comply. If you come to the hospital and you're asked to do something, please do it. That's your responsibility as a patient. And that responsibility is respect. Respect, they say, is reciprocal. It's part of your right to demand respect. But you should also know that healthcare providers and the people who are in hospital are human beings, one, and two, they are professionals, and must be treated as such. You wouldn't want to insult a healthcare provider and now say, I'm a patient, so I don't even receive an insult back. Help us to be true to our ethics. So respect, treat hospital staff, other patients and their relatives and other visitors with respect, and respect people's personal belongings and properties. Okay? The next one is rules and procedures. Every hospital have their rules and procedure. Please follow it. Be orderly. There are rules regarding visitation time. If you're patient relative or you're patient yourself, you have to, follow these rules. Don't sneak in this type of food. Please follow this rule. This will make for safety. This will make for hygiene. Just imagine everybody is behaving like you are behaving in the hospital. How dirty the hospital will be. So respect the rules and procedures. Another responsibility you will have is financial duties. Ensure that you bring money and pay. I know things are hard, but they have to pay people's salary with the hospital bill now. You have to buy medication with the bill. These things we say that I came to the hospital, they said I should do card first, they said I should pay bills first. It's because you will run away. We were in Nigeria now. Let's not even form touch. We will run away after they treat you. So why would someone want to treat you without you paying first? You have a responsibility to pay bills because hospital is run on money. Those medications that you are expecting to be there when you get there are bought with money. Those personnel are employed and they are human beings who should be paid. So fulfill your financial obligation so that we can fulfill our own obligation to you. And finally, safety and consideration. make sure that you are reporting safety risks. If you see something, say something. Don't try to be the good patient and not say, if you see something, if a nurse or a doctor or somebody is doing something that you term dangerous, it's better that you're wrong than that something happens that causes a very big problem. If you see a socket that is not working, mention it. It will make for your safety. You see an electrical work, you cannot be bringing in boiler to hospital. You're not considerate, because what if there's a fire outbreak and we have very sick people in the hospital? So these are some of your responsibilities that you owe us when you come to the hospital. So as we give you your own dues and we make sure that your rights are being held onto, please perform your responsibilities. Till I see you again, and Nurse Precious, you can drop questions, comments in the comment section, and I'm going to answer them. Thank you for coming again to Lightbulb Moments with Precious. I do appreciate. Bye.